Colles fracture. In today's video we will learn about Colles fracture. What is Colles fracture? This is a fracture at the distal end of the radius about 2 cm above the distal articular surface. Age. It is common in elderly, more common in post-menopausal women, and the patient here brings a history of fall on an outstretched hand like this. Anatomy. Here the fracture line runs transversely at the cortico-cancellous junction. There can be 6 typical displacements of the distal fragments. These are dorsal displacement, dorsal angulation, proximal shift, and the lateral displacement. Here, in Colles fracture we see the dorsal displacement and the lateral shift. In Smith's fracture we see the ventral displacement and the medial shift. Other associated injuries, these are fracture of the ulnar styloid process, fracture of the ulnar collateral ligament, and injury to the interosseous radioulnar ligament. Clinical features: pain and swelling around the wrist and the dorsum of the hand, dinner fork deformity due to the dorsal and lateral displacement of the distal fragment, tenderness is present, and painful abnormal movement of the affected hand. Here, dinner fork deformity due to the dorsal and the lateral displacement. Investigations we do is a plain X-ray of the affected wrist, both AP and lateral view. AP to see the lateral or medial displacement, and lateral to see the anterior or posterior displacement. Here, we do the AP view to see the medial or lateral displacement, and here the lateral view to see the anterior or posterior displacement. Treatment: if the fracture is not displaced and if the fracture is displaced. If not displaced, then immobilization with a below elbow Colles cast for 3 to 6 weeks. And if the fracture is displaced, then close reduction by traction and counter traction under general anesthesia followed by Colles cast for 3 to 6 weeks. This is a Colles cast. Complications. The complications are injury to the radial artery, stiffness, malunion, carpal tunnel syndrome due to median nerve injury, Sudeck's osteodystrophy, and subluxation of the inferior radioulnar joint. Thank you.